Hello everyone, welcome to Talking Health with Dr. Laz, your favorite health program on television. We're reaching you from your channel of choice, AIT, from Nigeria's capital city, Abuja. April 7th, 2021 is World Health Day, and I'll be having two guests that is going to join me to discuss issues around the health sector, even as the World Health Organization have put a theme that seeks to achieve a fairer and a healthier world. WHO wants all countries around the world, all stakeholders, government, private sector, to make sure that everyone, no matter the socioeconomic status, no matter where you live, no matter who you are, have access to quality, preventive, curative, and palliative care, and also living a healthier life that will even ensure that we don't have diseases. Over the past 1 week, a lot has happened in the health sector. It doesn't feel quite good marking the World Health Day when resident doctors across the country embarked on total strike, and a definite one for that matter. And of course, exactly a week ago, our president, left Nigeria for the United Kingdom for medical checkup. According to the statement released by the presidential spokesperson, Mr. President is going to be spending as much as 2 weeks. A lot of Nigerians have expressed concerns, and of course, there have been a lot of media reports that Nigerians living in the United Kingdom marched to the Nigerian house demanding that the president returns home. On social media, there's been a lot of comments and a lot of persons saying, why should our president still be embarking on medical tourism? But there's also media reports that the presidential spokesperson, Garba Shehu, said Mr. President is not a medical tourist, giving a reason that he's maintained UK doctors for over 30 years. Is our president really a medical tourist? I'll leave you to answer that question. So my guests will be introduced after the break, and I'm sure you're looking forward to meeting them. Do stay with us, we'll be right back. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, we're still talking about the World Health Day, which is 7th April 2021. Of course, 7th April every year is commemorated by the World Health Organization, governments around the world, and healthcare workers as World Health Day. And today we're looking at the health sector in Nigeria. The World Health Organization, WHO, is looking at building a fairer and healthier world. That's the theme of the World Health Day this year. And according to what it has on the website, it said all over the world, some groups struggle to make ends meet. With little daily income, we have poorer housing conditions and education, fewer employment opportunities, experience greater gender inequality, and have little or no access to safe environments, clean water and air, food security, and health services. This leads to unnecessary suffering, avoidable illness, and premature death, and it harms our societies and economies, unquote. So this is what the background the WHO is providing, and it said this is not only unfair, but preventable. Yes, all these conditions, we experience all of them in the country, and in the past 1 week, we know that a lot has happened, and today actually is day 6 since the National Association of Resident Doctors all over the country embarked on total and indefinite strike. The issues that caused the strike are not quite new. So joining me to have this conversation are two guests. Let me start from my far left, Barrister Ebenezer Egwuatu, the Executive Director of Lawyers Arise for the People Initiative, LAPI, right?
Yes,
is that how you call it? He is also legal team lead for the Make Our Hospital Work campaign, a member of the National Steering Team, and a patient advocate. You're welcome to the program.
Thank you, Dr. Laz. It's my pleasure to be here.
Thank you. So Dr. Julian Ojebo, is the immediate past Vice President, VP1 of the National Association of Resident Doctors. You're welcome to the program, Dr. Julian.
Thank you, Dr.
Okay, how do you say, let me start with you, Dr. Julian. I'm sure a lot of persons in the last week is been this conversation, debate, and even argument between your association, the federal government, and even, in fact, Nigerians are really tired, about these recurrent strikes. What's the situation? How did we get here?
Thank you, Dr. Laz. We actually got here from insincerity of government appointees to do exactly what they're supposed to do at the time they're supposed to do it. Now, the Nigerian Association of Resident Doctors, over time, we've always had these issues where we have to come to meet the federal government. We plead with them, we need this to be sorted out, we need this to be sorted out, but in real terms, they really don't do any of these. So this has accrued over time, and it is the result of what we are seeing today, that the Nigerian Association of Resident Doctors is demanding and saying that you must fix it now or never.
But this is not the first time such demands have come. Sometime last year, the resident doctors were also on strike. And I learned later in the year, there were some payments, some of the demands were met, like the medical residency training fees. And I could see that is also part of the current demands.
Now, the residency training funding is one of the components of the Medical Residency Training Act. Now, one other part of the Residency Training Act is that there will be abolishment of the bench fee payments by our people. Now, our doctors,
what's bench fee?
Our doctors, because of the poor infrastructural architecture of the health system in the country, doctors usually gravitate to centers, to teaching hospitals with seemingly equipped properties, better equipment that they can use to train. Now, over time, we found out that our doctors are paying because sometimes they have to leave their primary place of assignments for periods ranging between 4 months to 2 years, owing to poor infrastructural arrangements.
So if, for instance, a doctor is at the University of Abuja teaching hospital.
A doctor from University of Udu to Usman Danfodio University, Sokoto, who is doing radiology, but doesn't have access to radio-oncology department.
Okay.
He has to gravitate to either University College Hospital or he gravitates to National Hospital Abuja. So he has to train and be properly equipped and educated to fight the things that are ahead of him in terms of providing knowledge, providing the know-how, technical know-how, to attack those things he needs to know as long as the program goes. Now, the bench fee we pay usually ranging from 50,000 naira per month.
The doctor pays to
the doctor pays to the hospital.
Where he's going to?
Where he's going to.
Okay.
He's going to provide service to that hospital. You're telling him to pay. He's going to leave his family. He has to take care of his accommodation in his new domiciled area. So these are the issues that we are talking about. That the Residency Training Act is not complete. Now, you said you have paid for 2020. This act was signed in 2017. 2018 wasn't paid. 2019 wasn't paid. The payment of 2020 was epileptic. 2021 has also not been paid. So these are the issues. When government come out and say, we have done this, we have done that, and we now come back to the table and tell them, okay, you've only done 1% or 2% of one of our demands.
But what about, the COVID-19 had severe impact on the economy, and the government had said, yes, doctors should understand with the government that we don't have all the money to sort all this out at once.
Yes.
Will it not appear as if you are being insensitive, to the state of the country?
Yes. What brought us here is government insincerity and insensitivity to the plight of doctors. Okay, abroad these doctors have tax rebates, these doctors have hazard allowance, these doctors have poor, good remuneration, as it were, so they don't ask for more.
But the
reverse is the case.
Minister of Labour, Dr. Chris Ngige, was reported to have said that in the UK and in the US, that people pay to go into residency.
That is
How
actually,
true is that?
That
but
is actually,
here, the reverse is the case.
That is actually falsehood. Distinguished Senator Dr. Chris Ngige did not have enough information at the time he spoke, if we may try to put it lightly. In the US, remuneration for resident doctors in 2019 grew by 3% in 2020. An average United States of America resident doctors earns between $66,000 to $102,000 US. In the United Kingdom, you are even paid inconvenience allowance for you to be trained. In the far north, a resident doctor in the United Kingdom earns between £1,500 to about 6,000 Great Britain pounds. In a month. What do we earn in Nigeria? A professor of medicine in Nigeria cannot earn what a resident doctor is earning in the US, in Canada, in Australia, or in the United Kingdom. So what are we talking about?
But one might also say that is similar for other
when you
professionals,
when you talk about
doctors.
World Best Standard practices, you should put your mouth where you should put your money where your mouth is, actually. So you cannot tell us that they don't do this in the United States, they don't do this in the United States. However, in Nigeria, the reverse is the case. They have better remuneration. We don't have better remuneration.
Okay, so we'll come back to you, Barrister Egwuatu, Ebenezer. You've listened to what he said. I'm going to take you from the aspect of the rights of the citizens, the Nigerian citizens. We are seeking for a fairer and a healthier world. But as it is, quality healthcare is out of reach. More persons are, unemployment rate is about 33%, the last data that was released. That's 1 out of every 3 Nigerians are unemployed. And when it comes to young people who are the most productive, it's even higher percentage than that. So what would you want? Many Nigerians are unhappy. Some are even saying, should they even begin to sue both doctors, government, everybody, to know whether perhaps the judiciary will come to help in trying to get the health sector to work? What are your opinions generally with the current situation of our health sector?
It is sad each time one talks about not just the health sector, but every other sector. Today the focus is on health sector, so let us stick to the scope of our discussion. Our constitution does not guarantee a right to health. Our constitution.
But there's a right to life.
There is a right to life. I said a right to health.
Okay.
There are two different things. I think section 17.3 or thereabout, 3C, yeah, talks about, and number one thing we must understand that the section that even mentions health or something that you could stretch to look like health rights is not justiciable. That's chapter 2 of the Constitution.
Not justiciable means you cannot take it to court
to enforce that right.
Okay.
And what that section says is simply that states will direct their policies to ensure that the health, the safety and welfare of persons who are employed are guaranteed or safeguarded and not abused, something like that. So that does not culminate to your right to health is hereby guaranteed as obtainable in section 33, which talks about the right to life. So where you do not have a guaranteed health system that protects life, you will discover that the right to life you gave us in section 33, you had already taken away in section 17.3c.
So in this circumstance, what can do?
Well, the government has also tried by providing us with the National Health Act,
okay,
which for me is a fantastic legislation. If only, I stress again, if only Nigerians could go to court to enforce the provisions of that act. For example, section 20 makes it mandatory for hospitals to treat patients in emergency situation. So you cannot, why I like that particular section is for no reason. So you cannot say doctors are on strike, we will not admit you. You cannot say you have not paid fee, we cannot admit you. You cannot tell a patient there is no bed space. For this reason, we cannot admit you.
Okay.
In emergency situation.
In emergency situation. I think we have to take a break, and we'll take it off from there when we come back from the break. So because I would like to ask you, in this situation where there is strike, should patients who don't get attention in public health facilities begin to sue the likes of Dr. Julian or other persons who are on strike, So do stay with us. We'll be right back after this short break and continue this conversation. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, before the break, Barrister Ebenezer Egwuatu was talking about the National Health Act, the Basic Healthcare Provision Fund, and the rights of patients to receiving emergency medical care. On no condition should that, be denied. Barrister Egwuatu, would you want to read that section?
Yes. For clarity.
Not many persons know that, and then let's know whether Dr. Julian and all the striking doctors will now be at risk of appearing in court, in situations where emergency services are not provided. So while he's looking that up,
we have here.
Okay, you have it, right?
Yes, Section 20 of the National Health Act. I love this section. It says, a healthcare provider, health worker, or health establishment shall not refuse, when
it shall is a must.
Shall not refuse a person emergency medical treatment for any reason.
Including strike.
He said for any reason. Strike is a reason.
But strike is also recognized by law.
Is a reason. No bed space is a reason. The doctor is not around is a reason. There are plethora of reasons for which innocent Nigerian patients had been denied treatments in time past and are still being denied treatment solely because they have not activated the provisions of this act.
But some may argue that workers can go on strike. That is also legally recognized.
Yes, it now serves as a defense. But whether it's a valid defense is a different thing altogether.
It's for the courts to determine.
It's for the court to determine. Now, subsection 2 says a person who contravenes this section commits an offense and is liable on conviction to a fine of 100,000 naira or to imprisonment for a period not exceeding 6 months or both.
Okay. So for those, I think we need to note that Section 20 of the National Health Act 2014, besides the strike, which is an unusual situation, this applies to any healthcare facility, public or private. So the issue of you've not paid deposit,
it doesn't arise.
It doesn't arise.
So it is an emergency situation.
Provided it's an emergency.
Yes, we've talked about.
Okay, sorry, I'll stop you there because our time is fast. It's entirely a topic. We can choose a whole program to talk about the National Health Act, the Basic Healthcare Provision Fund, and all the rights of patients and health workers. Dr. Julian, there is a message I could see from our social media handle. There is a doctor in UCH, Dr. E. Olawale, said most of us are almost losing our minds. In fact, we can't work anymore. I have started informing my senior colleagues that after, I've started informing my senior colleagues, strike or no strike, I can't work anymore until my salary is paid. Many of my colleagues in my category are experiencing horrible things right now. Some of them had their children sent out of school and some beg to survive. Nearly 1/3 of registrars and medical officers in University College Hospital Ibadan have also not been paid any salary this year. That's from a doctor in UCH. There's also someone from UCTH Calabar. Intern house officers, they've not been paid from November 2020 to March 2021. I think that's from Chukwuma Ikechukwu. Then on those states, they say the last salary of doctors, we got this from a doctor working in a government facility, but prefers to be anonymous, said last salary for doctors was November 2020, last salary for doctors. November 2016, they are owing 20% of salaries. January 2017 salary has not been paid in Ondo State, according to what these doctors sent. And December 2020 to March 2021, salaries have not been paid. So, but it appeared on 29th of March, there was a meeting between Ondo Government Doctors Forum executives with NMA, and they agreed that 100% salary for December and January 2021 will be paid, while that of June 2020 for the University of Medicine teaching hospital residents will be paid along with the salary, and third tranche of COVID-19 allowance for consultants. So it's a long stuff and a whole gamut of issues of non-payment of salary. These are just examples. Like I said, I think they said in Abia State, several months, more than a year, of. So what are the issues? Could you just in bullet points summarize all these outstanding issues, and what is the minimum that you and other health workers, because sometimes when resident doctors finish, Johesu or other union will start their own, and some of these issues are cross-cutting. So summarize them and prefer solution. Okay,
thank you, Dr. Laz. The first one is that house officers have not been paid for the period of December last year to March of this year. We said pay all of them without any form of issues surrounding whether quota or no quota. We don't want to hear any of those. Resident doctors under the Give Me platform, they've not been paid for 4 months. We said pay all of them. 17 of our members have died from contracting COVID-19. We said give them their death and benefit insurance allowances to their loved ones that they've left behind, and let them be happy and say they've done this for their country. Pay those 17 doctors, okay, in the first instance. We are saying that we want a sit down with the government between us and other unions for us to discuss in its totality the reviewed upward review of our hazard allowances. That's what we are saying they should do. We are also saying that we want them to abolish the bench fee payments that our members pay every year, and this has become a burden for them. We're also saying that there are some state governments that are being, for proper use of word, I want to say they are being very wicked. How would you owe someone for 20 months, like in the state of Abia State? Like in the state of Imo State, you are owing them for 8 months. Okay, now there are state governments that are doing very well. The likes of distinguished Senator Dr. Efanyato Okowa is doing very well. He's met that's the governor of Delta State. He's done over 80% of the demands of our resident doctors over there. We encourage him to also do more. Okay, His Excellency Dr. John Kayode, rather, governor of Ekiti State, is the governor of the governor. Is the chairman of the governors forum. He's also done more than 50% of what our residents are demanding over there. The governor of Oyo State is also doing so well. Okay. Do you understand? We encourage his other colleagues to emulate them.
Okay.
Do just like them and pay our members in those states. Domesticate the Medical Residency Training Act and implement them to the latter in all the states. Okay. So if you give us some of these things, give us the templates, give us the timelines to when you are going to do them, you cannot tell us that we are giving you a memorandum of action and then we'll listen to you.
Okay, that this you just mentioned, I recall a tweet where NARD said they are not an association of signing agreements, that they've signed MOU, they've signed
MOTOs.
What's the full meaning of the MOTOs?
Memorandums of terms of settlement.
So and
now we are now told to sign memorandums of action. Maybe tomorrow we'll go to memorandums of working expenditure. We don't even know where we are going to. And they tell us all of these are grammars.
But the minister said perhaps you guys don't quite understand some of these
we don't need to understand.
Intricacies of labor negotiations.
We are clinicians. All we do is to take care of our patients. He should do his job while we do our jobs. Okay, let's not miss politics.
Okay, so let's round up. We have very few minutes to end this program. Barrister Egwuatu,
well,
what's the way forward from the perspective of patients? What do we as citizens?
As citizens, I would just want to advocate that patients know their rights. Read up the National Health Act. There is the Patient Bill of Rights. There are a lot of documents guaranteeing patients' rights. There is the compulsory treatment and care for gunshot victims.
With gunshot injuries.
There is the HIV and AIDS Anti-Discrimination Act. There are a lot of documents that guarantees the rights of patients. Unfortunately, patients are acutely ignorant of the existence of this legal framework.
And many times we leave it for God.
That is a different issue. I would also ask patients or encourage patients to seek legal redress.
To go to
not just legal redress. There are three levels of redress. There is the administrative redress, which is bringing it to the knowledge of the management of the hospital. There is the professional redress, taking it to Medical and Dental Council, and there is the legal redress. So which is approaching the courts. So if at administrative level, at the professional level, you feel you've not gotten justice, you can approach the courts for legal redress.
Okay. I think many issues have come up, and we wish to continue, but time is, fast spent. I really want to thank you all for making out time from your busy schedule to be on this program. Dr. Julian is looking quite tired. I can imagine he's facing the struggle of the strike and all the negotiations. Thank you for being a part of this. And I think I want to add that as citizens, we have to be part of the efforts to make our hospital work, to make our health sector work. So like they said, know your rights and also play a role, and particularly for primary health care. Primary health care is not just health facility, but it's also the community. So we all own it. Let's play our part as ward development committees and as citizens, ask questions, have knowledge, and take actions. So it's the World Health Day. Let there be a fairer and healthier world. On this note, we'll be ending the program today. Thank you very much for joining us. We hope to see you again, same station, same time next week. But let's continue the conversation on our various social media channels. And don't forget to subscribe to our YouTube channel, TalkingHealth TV. My name is Dr. Laz Eze. Bye for now.